Peripheral artery disease is disease in the arteries of our extremities, our arms and our legs. It involves plaque buildup in the arteries, which can be due to a variety of reasons. This plaque buildup results in narrowing of the arteries, restricting blood flow in the heart and the brain, leading to things like heart attacks and strokes. Peripheral artery disease is one of the most underdiagnosed conditions, especially in our elderly population. 1 in 5 people above the age of 60 in the US have some degree of peripheral artery disease. That's 20% of the US. The most common symptoms are leg pain with walking. Some people just associate that with age. It may actually be due to restricted blood flow to the muscles in the legs causing that sort of leg pain. Probably the most important thing to do with peripheral artery disease is seek out screening before we get to a point where we are even considering things like amputation or development of wounds. Asking the right questions at your doctor's office is by far the most important thing that any patient can do if they have any concerns about vascular disease. The diagnosis of PAD is really a multi-step process. First, it involves a consultation with a specialist. Following that evaluation in clinic, non-invasive imaging is done, usually ultrasound and a blood pressure cuff study called a pulse volume recording. This allows us to evaluate the functionality of the blood vessels in the legs to see if we can identify any plaque in the arteries. None of this involves any needle sticks and usually takes about a total of a couple hours during an office visit to get all of the information that we would need. Treating peripheral artery disease, there are multiple ways. There's the least aggressive way, which is management just with medications. For some people, that's enough. Some patients need a more invasive procedure. There are surgeries where you can put in bypasses. Those tend to require hospital stays and can have some complications associated with them relative to procedures that we offer here at ECCO. Here we offer what's called an arteriogram, which is a minimally invasive procedure where we use X-ray and ultrasound guidance, do a needle stick into an artery. We thread a wire through that needle under X-ray guidance. We can then inject dye into the vessels that we're treating that lets us evaluate the flow of the vessel and look for any narrowings in the artery. Arteriograms can be performed at the hospital or they can be performed in an office setting like we have here at ECCO. They're done here at our office with moderate sedation, so there's no general anesthesia needed. We're not putting a tube down into your lungs to breathe for you. You're sleeping during the procedure. Usually the medications have worn off by the time you are leaving ECCO. Recovery from these procedures is relatively minimal compared to more invasive things like surgery. After the procedure, you are usually placed on blood thinners temporarily, usually around 3 months. After 5 days, you're back to your normal activities and doing what you would normally do on a day-to-day basis, but hopefully with significant improvement of symptoms at that point. Symptomatic improvement varies on what we're treating. If patients have leg pain and that's all they have from the artery disease, that leg pain should get better within 72 to 96 hours after the procedure. You may also see muscle growth after we've restored blood flow due to the oxygen getting to the muscle that it wasn't getting beforehand. There's good research out there to show that when procedures are done in an office setting like here at ECCO, there's lower infection rates, lower complication rates, and better outcomes overall. Your procedure starts on time and you get out of here on time.